There are medications you need to stop taking before the surgery. Specifically, drugs related to aspirin, which can cause bleeding tendencies, need to be stopped at least 10 days, and usually we advise about 2 weeks prior. At least 10 days, typically 14 days or 2 weeks. We recommend stopping them in advance. Of course, on the day of surgery, you need to fast for 4-2, generously 8 hours before coming. During the pre-surgery consultation, if you contact the hospital, our staff will provide detailed information, including written instructions. During the pre-surgery consultation, we'll explain the precautions, arrival times, and the duration of your stay in the hospital. We'll provide detailed information. The surgery cost ranges from 4 million to 6 million Korean won, which is roughly 3,000 to 5,000 US dollars. The cost varies depending on the size of the chest and the glandular tissue, resulting in a differential surgical cost. Yes, it's a fixed price. We do provide interpretation services for our foreign patients. Naturally, we offer interpretation services for foreign patients. I can explain to some extent in English, and our consultation manager is also very fluent in English, providing interpretation services. We offer interpretation services. Regarding flying after the surgery, medically, there's no issue with flying even on the evening of the surgery day. There's actually no problem. However, we recommend resting in a hotel or accommodation for at least 2 days after the surgery. It is recommended to rest at the hotel or accommodation and get plenty of rest. We recommend flying back home 2 to 3 days after the surgery at the earliest. Regarding your stay in Korea, since it's a surgical procedure, what we recommend is at least about a week. Staying in Korea, you can travel after the surgery. You can move around immediately after the surgery. So rest on the day of surgery and the following day and start traveling from the third day. It's good to stay in Korea for about a week. It's really good. For those with very tight schedules, some patients do return home immediately after the surgery. There are actually people who get surgery and immediately return to their country. In those cases, flying back after 2 or 3 days is possible, but staying for about a week would be better. That's what I can say as a doctor. Regarding the recovery period after the surgery, we talk about it slightly differently depending on the size of the gynecomastia. But if it's a large size, for larger sizes, chest exercises like bench press or push-ups are possible from 4 weeks after the surgery. For smaller sizes, it's from 2 weeks after. You can resume your daily life immediately.